Do you know what the top demographic for cosmetic procedures is year over year across all procedures? Welcome to the Trillium Show. I'm Dr. Jason Hall, board-certified plastic surgeon, author of the new book, The Art of Aging, which is out on Amazon right now. Click the link in the description. You get it in one click. Every year, the American Society of Plastic Surgeons releases their procedural statistics for both surgical and non-surgical things. And every year, one demographic comes out as being at the top or near the top for almost every surgical procedure and almost every non-surgical procedure. And that demographic is women over the age of 45, which really, if you think about it, plastic surgery and non-surgical cosmetic things really have been, from their start, heavily dominated by female clientele. We're seeing an uptick in guys, not many, but they're there. But women over 50 typically comprise the majority of the patients that we see. Certainly in my practice, most of my patients are over 40, whether that's face, whether that's breast and body. The over 40 group is year over year is my top demographic. And there are a couple of procedures specifically that I want to talk about today, which are kind of the top trends for that demographic, your demographic, in 2025. First of these is non-surgical facial rejuvenation. And I talk a lot about non-surgical rejuvenation, especially a lot more than I thought I would talk about when I went into plastic surgery, because it is so important. It was so important that I wrote a book about it. So we'll talk about some of those trends. So things like lasers, things like radiofrequency microneedling, things like injectables, things like Botox, fillers. All of those are very popular because they fit in a specific group of treatments that are designed to enhance your appearance without surgery, hence the non-surgical rejuvenation thing. Botox, everybody pretty much knows about. I've done numerous podcasts, talked a lot about it in the past. You can check out some of those videos here. Fillers also serve a role to kind of reverse the volume loss that happens to all of us in our face over time. Have to be really careful about the use of fillers because it's very easy to overdo them, but they do serve a role. Lasers also serve a huge purpose in non-surgical facial rejuvenation in this demographic. We start seeing an accumulation of skin damage, both pigment, so brown spots, sunspots, things like that show up over time as a result of a long-term sun exposure. We also see age-related thinning of the skin. So the undersurface, the dermis of the skin, starts to thin over time because of collagen loss. And so treatments like RF microneedling, like non-ablative lasers, can help to start to reverse that when used in conjunction with collagen-boosting skincare products, the topical growth factors, which I talk a lot about in the book. And all of those are great non-surgical treatments for women who have started seeing volume loss, skin changes that happen to everybody over time. The second trend that is really taking off is the rise in body contouring. And this is, body contouring, tummy tucks, liposuction has been popular since people started doing them, but the popularity has grown immensely with so many people being on these GLP-1 agonists, the Ozempics of the world and things like that, because we're seeing people get skinnier, but then their skin doesn't snap back. And so there is a rise in the need in quotation marks for cosmetic procedures of surgical body contouring, removing and tightening some of that excess skin that's left over after you've lost weight. That includes tummy tucks, that includes breast surgery, that includes arm and thigh lifts, that even includes facial surgery. And so we're seeing that increase, and we'll probably see that become even more popular as time goes on and more people are using these GLP-1 agonists, love them or hate them. The third thing that we're seeing a lot of in this demographic, which is not surprising because of, time-related changes in people's faces, is the rise of facial surgery. Facelift surgeries, particularly the deep plane facelift, is getting more and more popular year over year. And I think that trend will continue. And with a deep plane, especially, the natural appearing, not pulled results, people are starting to realize more and more that you can have a big facelift without looking necessarily like you've had a facelift. And so this is something that I see getting even more popular, growing in popularity over time. Lastly, and this is one that I've just awoken to recently, is hormone optimization. You hear more and more people talking about bioidentical hormone replacement. And just in my own personal experience in my office, patients who are on bioidentical hormones feel better, they look better, and they're able just to perform at life better. And this is not, bioidentical hormones are not going to your obstetrician gynecologist and getting put on birth control. There are a lot of risks to that, which are, well documented. Bioidentical hormones are replacing all of the hormones that you're missing. And for women, that includes not only progesterone, estrogen, it includes testosterone, it includes things like DHEA, and being able to have those levels measured, replaced, and then measured over time to get you to an optimal point. So, putting your hormone levels around an optimal level for somebody in their 30s, people look better, they feel better, and they function better. And so I see that as being something that is going to be growing in popularity now. And, just like with injectables, it's really important, just injectables, surgery, pretty much anything that you do in this space, you want to find somebody who's good at what they do, who's devoted to learning about what they're doing and improving over time, and monitoring you over a long period of time. So toxin filler, surgery, both facial surgery and body surgery and hormone optimization are the four things that I really see taking off in 2025 and beyond. I hope you've enjoyed this episode. If you've got any questions, any ideas for other shows, please DM me on Instagram at Dr. Jason Hall, shoot me an email, info@drjasonhall.com, and pick up a copy of my new book, The Art of Aging, on Amazon. Click the link in the notes to get it.